What seems like simple, forgetfulness, may actually begin with difficulty staying focused. Poor concentration doesn't always come from the brain itself. Hearing loss, poor vision, dehydration, medication side effects, and other health conditions can all reduce your ability to stay focused, while mild changes in attention can occur with normal aging. Persistent or worsening concentration problems deserve attention, because some causes may be treatable. In today's video, we'll explore 15 medically recognized reasons why staying focused may become more difficult after age 75. More importantly, you'll learn which changes may be expected with aging and which ones should be discussed with a healthcare professional. Point 1. Low vitamin B12. Levels may affect the nervous system and cognitive function. If concentration problems develop gradually, your healthcare provider may recommend testing to determine whether a deficiency is contributing to your symptoms. Point 2. Hearing loss may quietly reduce your ability to stay focused. As your brain works harder to understand speech, fewer mental resources remain available for attention and concentration. Point 3. Even mild dehydration can affect how clearly the brain functions, because older adults often feel less thirsty. Staying well hydrated becomes especially important. Point 4. Some medications may cause drowsiness, slower thinking, or reduced alertness. Never stop taking a prescribed medication without first discussing your concerns with your healthcare provider. Point 5. Vision changes can affect concentration much more than many people realize. When reading becomes blurry or recognizing faces requires extra effort, the brain has to spend more energy processing visual information. This additional mental workload can leave you feeling tired and distracted during everyday activities. Many older adults assume this is simply part of aging, but an eye examination may identify problems such as cataracts or other treatable conditions. Keeping your vision as clear as possible can help reduce unnecessary mental strain and support better focus throughout the day. Point 6. Poor sleep quality is one of the most common reasons older adults struggle with attention. Even if you spend 8 hours in bed, frequent awakenings or sleep disorders like sleep apnea may prevent your brain from getting the restorative sleep it needs. As a result, you may wake up feeling mentally foggy, forgetful, or unable to concentrate on simple tasks. Poor sleep may also increase daytime fatigue and reduce your ability to process information efficiently. If sleep problems continue for several weeks, discussing them with a healthcare professional is an important step. Point 7. Depression in older adults is often overlooked because it doesn't always appear as sadness. Instead, some people experience low energy, lack of motivation, slower thinking, and difficulty concentrating. Family members may mistakenly assume these changes are simply caused by aging. However, depression is a medical condition that can often be treated through appropriate care. Recognizing these symptoms early may improve both emotional well-being and cognitive function. Point 8. Mild cognitive impairment, or MCI, describes thinking changes that are greater than expected for normal aging, but do not significantly interfere with daily independence. Difficulty staying focused may appear before more noticeable memory problems develop. Not everyone with MCI goes on to develop dementia, and some people remain stable for years. An early medical evaluation can help identify possible causes, rule out reversible conditions, and provide guidance for ongoing monitoring. Seeking advice early gives you the best opportunity to understand what's happening and plan appropriate care if needed. Point 9. Poorly controlled blood sugar may temporarily affect concentration and mental performance. Keeping blood sugar within your healthcare provider's recommended range supports both physical and brain health. Point 10. Chronic stress can interfere with attention and make everyday tasks feel more difficult. Managing stress may help improve mental clarity over time. Point 11. Regular physical activity supports healthy blood flow to the brain. Even moderate exercise may help maintain cognitive function as you age. Point 12. Thyroid disorders can sometimes slow mental processing and reduce concentration. A medical evaluation and simple blood tests can help determine whether your thyroid is functioning normally. Point 13. Although occasional lapses in concentration can happen to anyone, sudden confusion or a rapid decline in attention should never be ignored. These symptoms may sometimes be caused by serious medical conditions, such as infections, medication-related problems, metabolic disturbances, or stroke. If confusion appears suddenly, especially when accompanied by weakness, difficulty speaking, severe headache, or changes in consciousness, seek emergency medical care immediately. Prompt evaluation can be critical because some causes require urgent treatment. Acting quickly may improve outcomes and reduce the risk of long-term complications. Point 14. If you've noticed ongoing difficulty staying focused for several weeks or months, it's a good idea to schedule an appointment with your healthcare provider. They may review your medications, evaluate your hearing and vision, check for vitamin deficiencies, assess thyroid function, or recommend cognitive screening based on your symptoms. These evaluations help identify whether your concentration problems are related to normal aging or an underlying medical condition. Many treatable causes can only be confirmed through a proper medical assessment. The sooner the cause is identified, the sooner appropriate treatment or management can begin. Point 15. The encouraging news is that many factors affecting concentration after age 75 can be managed with the right approach. Staying physically active, eating a balanced diet rich in essential nutrients, drinking enough water, getting quality sleep, managing chronic medical conditions, and attending regular health checkups all support healthy brain function. Equally important is paying attention to new or worsening symptoms instead of assuming they're simply part of getting older. Early recognition allows healthcare professionals to identify reversible conditions and recommend appropriate treatment whenever possible. Protecting your ability to stay focused is an important part of maintaining independence, safety, and a better quality of life. As you continue to age, Point 16. Social isolation may have a greater impact on brain health than many people realize. Regular conversations, meaningful relationships, and participation in social activities help keep the brain actively engaged. Studies have found that older adults who remain socially connected often maintain better cognitive function than those who spend long periods in isolation. While social activity cannot prevent every cause of cognitive decline, staying connected with family, friends, or community groups may support overall mental well-being. Even simple, daily conversations can provide valuable mental stimulation. Point 17. High blood pressure that remains uncontrolled for many years can gradually damage the small blood vessels that supply the brain. This may reduce the brain's ability to function efficiently over time, affecting attention, memory, and thinking skills. Because high blood pressure often has no obvious symptoms, many people don't realize it is causing harm. Regular blood pressure monitoring, following prescribed treatment, and maintaining a healthy lifestyle are important steps in protecting long-term brain health.